Welcome back. It's now time to go in depth. Jamaica's health sector has been in the spotlight, and unfortunately the news has nothing to smile about. The poor condition of Jamaica's health care system has been no secret, but a health audit commissioned in May this year and finally released to the public on Friday confirmed some of the country's greatest fears. Theater rooms being susceptible to contamination and bacterial growth because they aren't properly closed and in some cases infested with termites, questionable cleaning chemical used to clean hospitals. These are just some of the damning findings of the health report, and to help us understand the issues and possible solutions going forward, we are joined by medical doctor Mr. Michael Abrams and former president of the Nurses Association of Jamaica, NAJ, Mrs. Edith Allwood Anderson. Thanks so much for joining me, lady and gentlemen.
Good afternoon to you and your audience.
Okay, let's start with you, Mrs. Allwood Anderson. Were you alarmed by the findings of the health report?
No. Absolutely not. I personally recognize that there are deficits, both management deficits and patient care deficits and operational deficits in the hospital over the years. And so what I'm saying is that the findings itself is not alarming to me, is that we just need to intensify and work more.
But Dr. Abrams, these findings are really shocking, some people would say. How did we get here?
That's a good question. I think there has been a gradual deterioration over the years. It's hard to say exactly when it would have started, but it's been in a bad state for quite a while.
So these conditions, Mrs. Anderson, you would be accustomed to them, I could say, based on your service in the health ministry.
Well, perhaps you need to ask me what are some of the things that I'm accustomed to.
Yeah, go ahead, especially with the reports that the doors aren't able to close and bacterial fungus and stuff like that growing on them. Are those really true?
What I know is that over the years, most of our hospital facilities are old facilities, which they have certain kinds of things that should make them closed. They have an inner door and an outer door. In terms of the cleaning of theater, I am aware that there are certain standards and protocols that must be adhered to. And I will never say that a door or doors must not be replaced because they cost a lot in terms of taking off the magnetic strips, putting them on, and so on. But in terms of entering a theater, you don't just enter a theater like that. No doctor, no nurse, no worker. You have to be properly clothed. When you get to theater, you have to properly scrub. I know doctors scrub for like 10 minutes. The kind of scrub that you use, and so on. So I'm saying to you, I am aware that there are issues regarding the doors. There are old doors. They take off the strips. Sometimes the strips need to deteriorate. But you have an inner door, and to get into an outer door, and to get into an inner door of theater, you have to be cleansed from the outer door, in the outer areas of theater, putting on your shoes, be dressing, washing your hands. When, for example, when a doctor washes his hands, the doctor do not put on their own gown. The nurses gown the doctors.
Okay, Dr. Abrams, now one of the problems highlighted in this audit is a shortage of equipment to aid in the delivery of babies. Now, what are we talking about here? The absence of these equipment like forceps, scissors, etc. What are some of the problems these could cause?
Well, it just makes it more difficult. For example, I think I'd read that they had a shortage of instruments to perform what they call episiotomies. That's when you cut the vagina to assist with delivery. I think they had mentioned a shortage of these instruments called cockers used to clamp the umbilical cord. They just make it more cumbersome, really. Sometimes when you lack the proper instruments, you have problems with maintaining techniques that are hygienic, and that can be a problem.
But also the scissors and the clamps, they over time they deteriorate, and sometimes they are missing because scissors are things that, for example, they get missing in terms of persons, in terms of the trays when you send them to the ward, what you get back, because people like scissors, and so you have to replace them on a regular basis.
But Dr. Abrams, why is it that the hospitals are out of these critical equipment?
It's a hard thing to answer because it could be multifactorial, but I know that the health sector has been cash-strapped for quite a while, and that is a contributing factor. That's a definite contributing factor. I think that when the whole free healthcare system was instituted, it sounds like a good idea, and nobody should be denied health care because of money or lack of money. But it's a very difficult system to maintain. I don't think it's really sustainable in our country at this point in time. And someone was pointing out to me that at the time it could have worked.
Yeah.
But it may have worked in terms of bank supplies, but it's a critical thing many people overlook, and it's the fact that many healthcare workers are underpaid, especially the nurses. This is Albert Anderson will tell you this. So even when the previous administration had instituted that, the nurses were still being grossly underpaid.
Yes, remember I had a long thing with them, and that has not been rectified till now in terms of reclassification, but we had 38-point claim regarding some of the very issues now.
Yes, Mrs. Anderson. And I hear you hinting at Dr. Abrams' comment. Do you believe the free healthcare, the institution of it, may be having an impact on the quality of health we have in Jamaica?
Yes, ma'am, because remember, what we said from the beginning, 2007, there was a hurried way in which it was declared. And we know that there was no planned financing, and that we did not have increase, for example, in HR staff and all of that to cope. Bustamante, remember, they were overcrowded, and to this day, Spanish Own Hospital is a B hospital, and it's overcrowded because of the population of Portmore and so on. And we are still having those kinds of, in terms of staffing, we have like a 20, 30-year cadre. We're talking about looking after it now and reviewing it, redesigning the health sector. We need more hospitals, The population has grown.
Mrs. Anderson, probably asking for more hospitals, though is an urgent need, maybe something in the future may take a while to be built. But
Absolutely.
What can we do now, immediately, with all the concerns the audit has published? What do we do now?
Well, I would say some of the concerns, because I still disagree with a lot of the deduction and inductions of the audit. For example, I have a disagreement with the whole question of enema for pregnant mothers, because over 20 years we scientifically we don't give enema because of a lot of things. And so I don't know where that rationale came from.
Yes.
Secondly, there are many persons having done studies and having gone, there are certain areas that you must wear a mask. But the key thing now is doing what you call making sure you have a nasal swab and all those things. And if you have an infection, a cough, or all of those, you enforce the rule where the persons don't go near the nursery or certain areas like theater and so on. And the accountability is on the operations level, the administrative level to enforce. And I'm saying I agree that we need more money, but I'm saying you could put a whole lot of money in the health sector and still if you don't enforce, enforcement at operational level is key. And the persons who are accountable for patients' lives, for saving, for caring, make sure that they do what they have to do. We take an oath.
All right, Dr. Abrams, for our viewers, what's really enema?
No, enema is a solution that you insert, that you introduce to the rectum to evacuate the rectum. because during delivery, when women push the baby out, stool can be pushed out as well. But as Mrs. Alwood Anderson has said, you really have to give an enema. The important thing is that the patient is tidied up properly afterwards.
Absolutely.
In the report, they mentioned that the place had a foul odor. You should notice that. Because many women push out stool with the baby, but you just clean them up afterwards. But back to what you're asking about, what can be done. It's not just about, money is one thing, but proper administration is another.
Yes.
And it's important to hire people who have the right attitudes and aptitudes for their jobs. And that's part of the problem. I think there are too many people in positions of authority in health who are not as passionate about the health of the populace as they should be. And that's part of the problem. Having people in positions where they clearly where they lack leadership
quality
skills.
of care. You make sure that you are given a job to do and you do it to the best of your ability.
Yes.
You see an issue. I've always said to nurses and other persons, the customer come in is as a result of the customer why you have a job.
Yes.
So there, once the customer they go in, how can I help you? When they speak to you, what is your issue? How can I make you more comfortable? We need to enforce it if we see something wrong, like somebody is using a mop that is incorrect. We should definitely report it because most of the persons have the power to say, no, this cannot be done here. We have managers at every level. We have job descriptions at every level.
Dr. Abrahams, apart from customer service improvement and better administration and probably moving away from free health care, what else can be instituted?
Well, as I said, the financial thing and the money thing is part of it. I think there should be a minimal user fee. And let me make a point. There are some people who really cannot afford it.
No.
But what happens is there are some people who actually have health insurance.
Yeah.
Who utilize the public facilities, and they don't use it. So, for example, somebody may have to do an operation, and let's say the insurance company may pay $50,000 towards the operation, and they can't find a co-payment. They go to a public hospital, and none of the insurance is used, when the hospital could have easily gotten $50,000 from one person, which would go a long way. So I think that system needs to be revised. They have to really look at the people they choose to run some of these places or departments. And sometimes politics is involved. And you really need to look at the competence of these people. And when they don't perform, you get rid of them. So there has to be some accountability. And
yes.
that's part of the problem. No. There's minimal accountability. No. Because, for example, when we had the chikungunya outbreak, there was a meeting in Jamaica 2 years before the outbreak. People from 22 countries met in Jamaica for 3 days to discuss chikungunya in great detail. 15 representatives from Jamaica were at that meeting. Yet when chikungunya came, they weren't telling us that it could kill you or make you, disabled or put you in pain for months or years. It was when people started dying and getting very sick, we started to hear these things. And we started to hear that there were concerns about the tourism sector, where they didn't want to affect it by saying too much.
Dr. Abrams, not to cut you, but we are
left after that.
Dr. Abrams, not to cut you, but we are running out of time, and I just want to ask you this critical question: do you think Dr. Fenton Ferguson, the Health Minister of Jamaica, should have resigned?
I think he should have resigned from the chikungunya mishandling. And it's not just about him, it's about the people advising him. I think he and at least one or two other people should have left from that time because that was grossly mismanaged.
And what say you, Mrs. Anderson?
What say you about what?
Dr. Ferguson, should he have stayed?
Should he have resigned?
Right.
What I think he should have done initially is take some stand on the persons who advise him.
All right.
He's not just a policy man. And the persons who are under him are accountable.
Okay.
You have the PS.
We have to leave it there.
You have
Thank
the CMO.
you.
Where are they?
Okay, thank you so much, Mrs. Edith Allwood Anderson and Dr. Michael Abrams. The discussion continues. We just spoke to former president of the Nurses Association of Jamaica, Mrs. Edith Allwood Anderson, and medical doctor, Mr. Michael Abrams, about the state of Jamaica's healthcare following the release of the audit.